All right, and good afternoon, and welcome to the Board of County Commissioners meeting. We recessed this morning after a meeting, and we're reconvening right now. It is March the 12th, 2020, and it's about 1:05 in the afternoon, and this is regarding a resolution. And so before I read the resolution, do my seatmates have any questions or comments? Not questions, but any comments?
Well, I guess if I had a comment, I'd say we're looking to the professionals like Dr. Wu that's going to guide us through this. So I really appreciate her attendance here.
All right. Then with that, I'm going to go ahead and read the resolution. This is a resolution of the Board of County Commissioners declaring a local emergency. Whereas on January 21, 2020, the Washington State Department of Health confirmed the first case of novel coronavirus, or COVID-19, in the United States in Snohomish County, Washington. Local health departments and the Washington State Department of Health have since that time worked to identify, contact, and test others in Washington State potentially exposed to COVID-19 in coordination with the United States Centers for Disease Control and Prevention, the CDC. And whereas on February 29th, 2020, the governor of the state of Washington adopted Proclamation 20-05 and proclaimed that a state of emergency exists for all counties in the state of Washington as a result of COVID-19. Whereas on March 10th, 2020, the governor signed Proclamation 20-06, addressing risks to persons living in congregated care centers and imposing certain restrictions in all counties in the state of Washington. Whereas on March 11, 2020, the governor signed Proclamation 20-07, imposing restrictions on large gatherings in King, Snohomish, and Pierce counties, prohibiting the following activities in King, Pierce, and Snohomish counties related to social, spiritual, and recreational gatherings, which restrictions shall remain in effect until midnight on March 31st, 2020, unless extended beyond that date. Gatherings of 250 people or more for social, spiritual, and recreational activities, including but not limited to community, civic, public, leisure, faith-based, or sporting events, parades, concerts, festivals, conventions, fundraisers, and similar activities. And whereas COVID-19, a respiratory disease that can result in serious injury or death to vulnerable or at-risk populations, is caused by the SARS-CoV-2 virus, which is a new strain of the coronavirus that had not been previously identified in humans and can easily spread from person to person. And whereas on March 11, 2020, Thurston County has had one confirmed case of COVID-19, and whereas as of 4:10 p.m. on March the 10th, 2020, the State Department of Health was reporting 267 cases, confirmed cases, and 24 deaths statewide. And whereas the CDC identifies the potential public health threat posed by COVID-19, both globally and in the United States, as high, and has advised that person-to-person spread of COVID-19 will continue to occur globally, including within the United States. And whereas on January 31st, 2020, the United States Department of Health and Human Services Secretary declared a public health emergency for COVID-19 beginning on January 27th, 2020. And whereas the county's declaration of a local emergency will allow the county to undertake emergency purchases pursuant to RCW 36.32.270 and RCW 39.04.280 when such purchases require immediate action in the event of an emergency. And whereas the county's declaration of a local emergency will allow the county, pursuant to RCW 42.30 38.070, if by reason of the declared emergency, there is need for expedited action by a governing body to meet the emergency, the presiding officer of the governing body may provide for a meeting site other than the regular meeting site, and the notice requirements of the Open Public Meetings Act shall be suspended during such emergency. Whereas the conditions stated above constitute an emergency for Thurston County, necessitating activation of the Thurston County Comprehensive Emergency Management Plan and the utilization of emergency powers granted pursuant to RCW 36.40.180, 38.52.070 subsection 2, and 38.52.110 subsection 1. Now, therefore, the Board of County Commissioners of Thurston County, Washington, does resolve as follows. Section 1, there is hereby declared an emergency as defined in the Thurston County Comprehensive Emergency Management Plan, or PLAN, due to the worldwide and local outbreak of COVID-19, and for all reasons stated in the Governor's proclamations 20-05, -06, and 07. Section 2, pursuant to the emergency declared in Section 1, county departments and offices as designated pursuant to the plan are authorized to enter into contracts and incur obligations necessary to combat such emergency to protect the health and safety of persons, property, and the environment, and provide emergency assistance to the victims of such emergency consistent with the plan. Section 3, the Thurston County Manager is authorized to make and adjust human resource policies related to leave usage and other issues related to employees as necessitated by the impacts of COVID-19. And Section 4, pursuant to RCW 42.03.070, all meetings of the Board of Health and Board of County Commissioners relating to the COVID-19 emergency are not required to meet the notice requirements and meeting location restrictions of the Open Public Meetings Act. Section 5, the proclamation of a local emergency set forth as Section 1 shall terminate at midnight on the first Wednesday following the 30th day after the date the emergency resolution is adopted. This resolution shall become effective immediately. March 12th, 2020, and it's about 1:13 hours in the afternoon. This will be signed by your county commissioners. Any questions or comments? Anything from you?
No, nothing in detail, but I did thank Dr. Wu for being here, and our prosecuting attorney, John Thunheim, is also present to make sure that we're proceeding in a legal fashion, and I'd like the public to know that.
And I'll just close this meeting, as we close it, by saying again, we thank Dr. Diana Yu for being our public health officer, and this board is taking paying maximum attention to this issue to protect all 1,100 employees and the public as well. And we've done numerous other little necessities around to keep people safe and the public safe. County Manager.
Commissioner, you may consider calling a vote to approve this resolution.
That was coming. Thank you.
Thank you.
So is there a motion? I'm done opining. Is there a motion?
Yes. I move. Well, is there a specific reference? No.
Resolution number?
Maybe
Refer to the resolution.
suggestion, move to approve a resolution declaring an emergency in Thurston County.
Okay, I'm going to move that we would approve a motion declaring an emergency to the coronavirus outbreak, provisions of which were just read forth by the chair.
Second?
So it's been moved and seconded to approve the resolution declaring a local emergency. Any further discussion?
No, sir.
Anything? All right, all in favor say aye.
Aye.
Aye, that motion carries. And now this meeting is adjourned.
and you will convene.
One 1:15 on Thursday, March 12th. Community Board of Health, we are here to consider a resolution, proposed resolution, which does have a number, H2020. And if I just follow the lead of the Board of County Commissioners Chair, I'll just read through the proposal and then we can discuss it and potentially act on it. So the proposal is a resolution ordering restriction of events over 250 people and requiring social distancing measures for events under 250 people to control and prevent the spread of COVID-19. Whereas on February 29, 2020, Governor Inslee proclaimed a state of emergency within the state of Washington due to COVID-19. And whereas on March 12, 2020, the Board of County Commissioners proclaimed a state of emergency within Thurston County due to COVID-19. And whereas state law, RCW 70.05.070, subsections 2 to 3 requires and empowers the local health officer to take such action as is necessary to maintain health and to control and prevent the spread of any contagious or infectious diseases within the jurisdiction. And whereas state law, RCW 70.05.060, requires and empowers the local Board of Health to have supervision over all matters pertaining to the preservation of the life and health of the people within its jurisdiction, and shall, 1, enforce the local health officer or administrative officer appointed under RCW 70.05.040, if any, the public health statutes of the state and rules promulgated by the State Board of Health and the Secretary of Health. 2, supervise the maintenance of all health and sanitary measures for the protection of public health within its jurisdiction. 3, enact such local rules and regulations as are necessary in order to preserve, promote, and improve the public health and provide for the enforcement thereof. 4, provide for the control and prevention of any dangerous, contagious, or infectious disease within the jurisdiction of the local health department. Further, whereas state regulation, Washington Administrative Code, WAC 246-100-036, requires the local health officer, when necessary, to institute disease control and containment control measures, including social distancing measures he or she deems necessary based on his or her professional judgment. And whereas there is evidence of increasing transmission of COVID-19 within Thurston County, scientific evidence and national public health guidance support strategies to slow the transmission of COVID-19 and protect vulnerable members of the public from avoidable risk of serious illness or death resulting from exposure to COVID-19. And whereas the age, condition, and health of a significant portion of the population of Thurston County places it at risk for serious health complications, including death from COVID-19. Although most individuals who contract COVID-19 do not become seriously ill, persons with mild symptoms and asymptomatic persons with COVID-19 may place other vulnerable members of the public at significant risk. And whereas a large surge in the number of persons with serious infections can compromise the ability of the regional healthcare system to deliver necessary healthcare to the public. And whereas the implementation of limitations on large gatherings and use of social distancing decreases the risk of COVID-19 transmission to our most vulnerable populations. It's especially important for people who are over 60 years old and those with chronic health conditions due to the higher risk of severe illness and death from COVID-19. And whereas this resolution will reduce the likelihood that many individuals will be exposed to COVID-19 at a single event, and will thereby slow the spread of COVID-19 in our community. And whereas this resolution will help preserve critical and limited health capacity in the county by reducing the spread of COVID-19. And whereas this resolution is issued in accordance with and incorporates by reference the March 11th, 2020 Governor's Executive Proclamation on COVID-19 Community Mitigation Strategies. Whereas on March 11th, 2020, we were notified about the first case of COVID-19 in Thurston County. As of March 20th, 2020, there are now 366 positive results and 29 deaths in Washington State, with with 12 counties reporting cases. And whereas this resolution is issued in light of a significant and increasing number of assumed cases of community transmission, and at a time when implementation of large-scale social distancing measures is recommended. And whereas on March 11th, 2020, the World Health Organization declared COVID-19 a global pandemic. And whereas social distancing measures can reduce COVID-19 transmission by decreasing the frequency and duration of social contact among persons of all ages, this order is issued to prevent circumstances often present in mass gatherings that may exacerbate the spread of COVID-19, such as A, the increased likelihood that mass gatherings will attract people from a broad geographic area, and B, the physical environment in which large numbers of people are in close proximity and have multiple opportunities for close contact with one another that facilitates the spread of COVID-19. And C, the difficulty in tracing exposure and implementing traditional public health containment measures when large numbers of people attend a single event. And whereas this resolution comes after the release of substantial guidance from Thurston County Public Health and Social Services, the Centers for Disease Control and Prevention, and other public health officials throughout the United States and around the world, the local health officer will continue to assess this quickly evolving situation and may modify or extend this resolution or issue an additional resolution related to COVID-19. And whereas the local health officer hereby finds it necessary to institute social distancing measures within Thurston County, now therefore be it resolved, the Thurston County Board of Health orders as follows. Number 1, within Thurston County, including all the cities and towns, gatherings of 250 people or more for social, spiritual, and recreational activities, including but not limited to community, civic, public, leisure, faith-based, or sporting events, parades, concerts, festivals, conventions, fundraisers, and similar activities are prohibited until midnight on March 31st, 2020, unless extended beyond that date. And number 2, within Thurston County, including all the cities and towns, gatherings with fewer than 250 attendees are prohibited unless event organizers take the following steps to minimize risk. A, only adults and individuals with underlying medical conditions that are at increased risk of serious COVID-19 are encouraged not to attend, including employees. B, social distancing recommendations must be met. For example, the limiting contact of people within 6 feet from each other for 10 minutes or longer. C, employees must be screened for coronavirus symptoms each day if symptomatic. D, proper hand hygiene and sanitation must be readily available to all attendees and employees. And environmental cleaning guidelines from the U.S. Centers for Disease Control and Prevention, or CDC, are followed. For example, clean, disinfect high-touch surfaces daily or more frequently. This resolution, if adopted, shall become effective immediately. So that is the proposed resolution. Do we have comments or questions about it, or from the board?
I would like to point out that we've had earlier discussions about this issue leading up to today, and Dr. Yu has been directly involved in this, and so I think we should move forward with it.
I agree. And first I want to reiterate what a welcome sight you are, Dr. Dinah Yu, to see you here as our public health officer as of yesterday. Yeah, Tuesday. We're all taking all kinds of necessary precautions and maximum attention to this issue. We've been briefed numerous times by Shelley Slaughter, Public Health and Social Service Director, and Kurt Harden with the Emergency Management Services, and close contact with HR as well, Maria Ponte. And we've attended DoH, state DoH webinars on this topic. Elected officials and department directors have been involved in updates and have increased cleanliness in and around the workplace. And just declaring this an emergency is, I think, the right, appropriate thing to do, but it evolves moment by moment. And so stay tuned, there'll be more updates, but that's all I have to say. Oh, Doctor?
Hi, thank you for welcoming me. I don't know why I'm here, but I'm just kidding. You know, it really is very important for us to take this seriously, but it's not time to panic. I think it's very important for us to really pay close attention to the social distancing, to the hand hygiene, making sure we protect the most vulnerable in our communities. You know, some people might say we're kind of jumping ahead, but I don't really want to wait for us to have 68 cases or even 17 cases like Pierce County before we take these kind of actions. I think if we can prevent the 17 cases, we're doing good. So hopefully we will not have a lot more, but I do anticipate that we will. We just want to blunt the effect of the pandemic here in Thurston County. Thank you for your support.
I just wanted to kind of lay out that, you know, what we're trying to get ahead of is the fear that our healthcare system would become overwhelmed by a sudden explosion of this illness, which we've seen in other jurisdictions. And then you have a situation where more people need to be hospitalized than our system can handle. And then you have a situation where more people die because they're in hospital beds or ventilators or equipment to keep them alive. So this is, I think, an appropriate approach. As Dr. Yu pointed out this morning, we have Pierce County in the situation that it's in, and Thurston County, we have overlapping, we have the JBLM, which has a free flow of employment and people living and working. We have a school district in Yelm that has schools within both counties. So I think it makes all the sense in the world to be as out in front of this as we can, given what we've learned over the last, literally what I've learned over the last few days about why these strategies make sense. So I'm comfortable that we're doing the right thing, and I would call for a vote at this point.
Do you have the resolution number, you
I
said?
do have the resolution number in this instance.
It's on top of.
I see it there. All right, thank you. And as Dr. Yu said, this is a time to be prepared rather than paranoid. I move that we adopt the resolution number H-03-2020 as read by Chair Commissioner Menser.
Second.
It's been moved, seconded. All in favor, say aye.
Aye.
Aye. Okay. Resolution 03-20020 is adopted, effective immediately. One more item I'd like to just raise before we adjourn Board of Health was I believe all the commissioners were provided with an email from a citizen who made a suggestion that is not something we're going to discuss today, but it's something that I'd ask legal counsel to maybe help us explore. It was looking at the economic impacts, what we're going to be looking at, and whether or not other jurisdictions have looked at moratoriums on evictions, foreclosures, utility shutoffs, and homeless camp sweeps during the period of time that we're adopting these emergency measures. I don't know if that's within the authority of the county commissioners or the Board of Health, but I would like us to calendar that for a future discussion with legal counsel, that we could explore what the right approach is on those issues, because there's going to be obviously second and third wave effects, as our Emergency Services Director Kurt Harden was explaining this morning. It's just going to be a ripple effect, and it's really going to affect the community, and I think we need to look at all our options. With that, anything else for the Board of Health?
No, sir.
No, sir.